It's the cruel reality of COVID-19. Most people who get it will get better without ever stepping foot in a hospital. But for the others, the ones who get really sick,
So with the coronavirus infection, we know that 19% of people will require hospitalization. And we know that 5% of total people will require intensive care unit beds.
according to the Colorado Hospital Association, the most recent count shows 12,558 total hospital beds in the state. 973 of them ICU beds, and another 876 that could be converted to ICU beds. So, is that enough? It's a question officials haven't been able or willing to answer.
And I worry that as the infection rates continue to climb, we're very quickly going to outstrip our current supply of hospital beds.
So we went to our expert, Dr. Pyle Coley.
In my opinion, I really worry that we're not prepared and we won't have enough hospital beds.
The closest anyone has come to contemplating such a thing is a 2009 study by the Colorado Department of Public Health and Environment. It looked at the effects of a moderate or severe flu pandemic, like the one that ravaged the country in 1918. Accounting for today's population, it imagined a best-case scenario for people needing hospital beds, more than 17,000. And a worst-case scenario, more than 190,000.
Those numbers really scare me because the flu is a lot less infectious than the current COVID-19.
That's why health experts say it's vital to slow the spread.
It's not so important what percentage of that population gets infected, but what's more important is what period of time it takes for that percentage of population to get infected.
Kevin Vaughn, 9 News.
It is important to note that some hospitals are adding beds as we speak, and that's not reflected in the numbers confirmed today by the Colorado Hospital Association. And this is looking only at beds, not critical equipment like the ventilators that the governor just talked about that Colorado still needs. And without that, the number of beds, well, that may not matter.